The toughest bit has been having to juggle quality and safety and value and meeting people's expectations. People expect an awful lot from their public health services, and we want to give them what they want, and sometimes you need to take into affordability and volumes and locality, and that's hard. I think that the time's right. I've done 4.5, nearly 5 years in the role as CEO at Southern District Health Board. I've enjoyed every minute of it, even the challenges and the difficult times that we've had as a health board, but it's been hugely rewarding, and I've had the privilege to work with fantastic staff and amazing teams that do great things on behalf of patients every day. And it feels that the organisation has had some turmoil last year and the board were sacked. We've now got a period of stability. We've got the Commissioner and her team who are committed for another period of time. We've got a really strong executive team. We've got strong clinical leadership, and it feels that the ship has been steadied, and if there was a time to step down, this is it. It's job done for me, certainly not done for the organisation. There's a lot of challenges and a lot of opportunities ahead, but for me it feels that I've come to the end. This has been my choice, and it's something that I discussed with Cathy before I went on leave, to say that I was thinking about my future and thinking about my ability to commit for another 3, 4, 5 years, the term that the commissioners will be there, and I wanted to take the month that I had off with my family to think that through. And when I came back, I sat down and talked to Cathy about it again and said that hand and heart I couldn't commit to that amount of time for personal and family reasons, and it would be disingenuous of me to start something that I wouldn't finish. It was really hard to lose a board that had appointed me, and I had an awful lot of loyalty to that board, particularly to the chairman. But the decision was made. It was the minister who made that decision, and all I want to do is do the best we can for the District Health Board. The role of a chief executive in any organisation is a role that's very challenging, and you have to make some difficult calls, but you don't make them on your own. You make them with your team, you make them with your board. And there have been some difficult and challenging decisions that we've made along the way in the last 5 years. The food services that you've brought up, controversial. I think I underestimated the strength of feeling of the public about food and how important food was, but I still think that was the right decision. It's taken some time to embed it and for it to settle down, but I still think it was the right decision that we made. Food before was very good, and the food now is very good. It's down to personal choice whether you think one hamburger's better than another. My plans are to have some time off, to think about what I want to do with my future, to get around and see this fantastic country that I've lived in for nearly 5 years in my camper van, and then just think about what I want to do next.